good morning, good afternoon, and good evening. And thank you so much for joining us for this virtual event, which is designed to thank you, our partners, and also give you a closer look at some of the work we as an organization have been privileged to carry out during the very difficult circumstances over the past 21 months. So, my name is Lisa Moon, and I am fortunate to lead the team here at GFN. So as a matter of housekeeping, we are really looking forward to an engaging dialogue. And so please feel free to submit your questions kind of throughout the webinar in the Q&A box. We're going to move to that a little bit from now, and we would like to get to as many questions as possible. So this year is GFN's 15th anniversary, and it is so wonderful to be able to connect with all of you today, people and companies that have helped build GFN, not just in these past 21 months, but over the past decade and a half. As many of you know, the COVID-19 pandemic has delivered significant setbacks in the fight against hunger and food insecurity. Most recent data from the Food and Agriculture Organization of the United Nations suggests that today, chronic hunger has increased by at least 10%. So that's the percentage of people that are facing daily, challenges in getting enough food and enough energy to survive. And then food insecurity has risen from 2 billion people in 2019 to 2.35 billion people today. Alongside that, it's very troubling that the FAO now estimates that as many as 3 billion people, or about half the world's population, are not able to afford a nutritious diet. So it was really thanks to tremendous partners like you that our network of food banks has been able to deliver a tremendous response to this humanitarian crisis. If you've been watching your email, you will have seen that in 2020, the GFN network of food banks served over 40 million people, which was up from a 16.9 million people service delivery in 2019. And they did this through providing the equivalent of 2.4 billion meals. This work was really made possible due to the community that came together to invest and volunteer in food banks around the world. GFN able to deliver thousands of hours of technical assistance since the start of this pandemic in March of 2020, and also has invested more financing in our partners than we had in the previous 14 years combined. And this support was truly needed. In fact, last year it was estimated that a GFN food bank received an average of 30% of their funding for pandemic response through our network, through our global partners, making all of you today one of the most important stakeholders in ensuring that food bank work was able to continue. So annually at GFN, we do a network survey where we want to listen to our partners about what GFN services they value most. And the results of our latest survey, which was conducted just a few months ago, indicated that it was not the financing that our members most valued, but the opportunity to access technical support and share best practices and learnings from global partners that they found to be most valuable about GFN. So today we want to give you a closer look at the types of support our staff team offer to the 49 food banking organizations that we're fortunate to serve, and how that support has changed and is changing as we move into a new era where COVID and increased hunger and food insecurity rates are unfortunately our new reality. So it is my pleasure to introduce 4 colleagues from GFN today. The first is Gabriella Kavahari. She leads our groundwork in the Middle East and Sub-Saharan Africa, including our terrific incubator program that launched 2.5 years ago, which supports new food banks from major urban areas on the continent. I'm also pleased to welcome Chris Rebstock, who helped establish GFN in 2006. And today he leads our work in India and our budding new food bank development program, which helps community leaders found and then launch organizations in highly food insecure communities. I'm also pleased to welcome Angela Supernaw, who is one of the busiest people at GFN for sure, leading all of our grant making work. And then also Tara Shyam, who's our Associate Director for Regional Product Sourcing based in Singapore, focusing specifically on our product and other partners in the Asia Pacific region. So really excited to share with you today some of the internal workings of GFN, and I'm going to now turn it over to Gabby to talk a bit about what she has been seeing through our incubator work, specifically in Sub-Saharan Africa. Gabby, over to you.
Thank you, Lisa. Good morning, good evening, everyone. So the work in Sub-Saharan Africa is really wonderful, almost, I guess, innovative work in food banking. Now that we have this incubator cohort, the incubator cohort is made up of 6 countries: Kenya, Ghana, Nigeria, Botswana, Ethiopia, and Madagascar. And we have a long-standing partner in South Africa, Food Forward South Africa, that some of you may know. So today I'm going to talk to you a little bit about 2 programs, one in Kenya and one in Ghana. So we'll go from east to west and tell you the story of food banking there. In Kenya, the food bank partner is called Food Banking Kenya, and they started out as a group called Platter of Compassion, a small group of friends who felt the need to support underserved populations in Nairobi. And they were really just pulling together food drives, sharing their resources amongst each other. And so they were visiting children's homes with the desire of helping these children in orphanages or street children that were living in these homes. And they had a desire to make a much bigger impact. So the group decided to formalize their actions. And in 2016, they officially founded Food Banking Kenya as an NGO. John Gathungu is the co-founder and executive director of Food Banking Kenya, and he has steered the organization from formation to a reputable organization today, partnering with a lot of different local agencies in the Nairobi County and beyond. He has over 20 years experience in the field, having worked with several nonprofits, including the Center for Legal Aid Network and Upendo Care Center for Autism, among other organizations. So I think that's a really important component of the food bank's work, right? The leadership and having that background in NGO work, in humanitarian work at a local level. These local leaders are really seeing what the community needs and responding to it. So Food Banking Kenya operates a warehouse facility, like you've seen a food bank maybe in your own neighborhood, in your own city. This is actually a brand new, beautiful warehouse made possible through partnership with GFN and other partners this past year. And they store and sort the surplus product that comes in and then redistribute it. They actively solicit food from growers, retailers, wholesalers, processors, wherever they can find it in the food system in Kenya locally. In 2020, they achieved astonishing growth, and they increased the food distributed from 2019, when they started working with GFN. They were at about 11,000 kilograms of food rescued, to an excess of 880,000 kilograms in 2020. This is during the pandemic, but also during a moment of incredible catalytic growth for their infrastructure, for their team. So an increase of nearly 8,000%. This enabled them to serve 174,000 vulnerable people in calendar year 2020. And that was an increase from the 26,000 they were able to serve in 2019. So this was an incredible growth facilitated by an expansion in physical infrastructure, like I mentioned, and moving into that new warehouse and purchasing a refrigerated truck even. So the innovation is really their agricultural recovery program in light of supply chain disruptions and exports to Europe, the Middle East, and other African markets being canceled. Food Banking Kenya partnered with both large commercial farms and smallholder farmers. In this model, Food Banking Kenya collects surplus from the farms, but provides some compensation to the farmers when necessary, so that they're not financially impacted, I guess, beyond those cancellations, right, of their orders. And it's typically with the smallholders. The commercial farmers will say, I have this huge amount of product. It's going to rot in my warehouse or in my field. So let's do something good with it. And they are seeing that circular economy and that circular kind of benefit for the community. So They the smallholders in this case, when they're not receiving compensation, also benefit from a donation of flour, cooking oil, or other surplus staples that the food bank is able to rescue in Kenya. So it's a really great program there. In addition to the farms, Food Bank in Kenya has also partnered with pack houses located close to the Nairobi International Airport, so they can rescue surplus product, which would otherwise be wasted at those facilities. And the high volumes of fresh produce that became available suddenly increased the nutritional value of the food basket that Food Bank in Kenya was providing to those agencies, the orphanages, the schools. That school feeding program became even more robust, and with the help of social workers and nutritionists locally, they were able to amplify their impact. So that's a bit about Kenya, and I think we are, I don't know if there are questions, or we can just keep kind of going into the next section. Or if I can just answer this anonymous question, Gabby, what are the typical types of products being rescued and distributed by food banks? It is really up to the food bank, and has to do more with what is available in the country. So if there is an ag sector that is, booming like in Kenya, or if it's a really good harvest season, then it's going to become whatever that produce is. Across the African continent, flour made of cassava or yam, or all of these roots and tubers is very important, and it's a huge supplement. So we've seen that being something that a food bank tries to rescue, and if they can't rescue them, they'll purchase it with the small amount of funding that they have to purchase food, but the rest of it is really, whatever fits their nutritional guidelines, whatever fits the safety protocols and guidelines that they have as food bank. So moving from east to west, I'd like to tell you a story about our partner in Ghana. The year is 2011 in Accra, and Chef Elijah Amuado meets a man with a mental disability who comes to his restaurant in search for food. He'd later bring those leftovers back to a group of vulnerable people. And when Elijah asked him, "Why are you doing that?" The man answered, "If I don't do it, nobody will." And so this moment really served as an inspiration to begin his work in hunger relief. He began it with an organization called Chefs for Change, and was thinking, okay, I'm in the hospitality industry. I know where the surplus is. I see all of this prepared food being wasted. Let me do something about it. And eventually it just took off and became something more along the lines of a food bank. So just to give you a background, Elisha is a Ghanaian chef and food stylist who's become a social entrepreneur through his creation of Food for All Africa. In 2017, Chef Ado was awarded the Queen's Young Leaders Award by Her Majesty Queen Elizabeth II at Buckingham Palace for his contribution towards reforming Ghana's food distribution system to reduce waste, overcome hunger, and alleviate poverty and malnutrition. So he's really looking to work within the Ghana School Feeding Program, within the structures that the government kind of started, and think about an innovative solution for a grassroots NGO to help out in. So Food for All Africa partners with a network of retailers, manufacturers, wholesalers, farmers, and growers, a lot like Food Bank in Kenya, to recover the edible surplus and redistribute it responsibly to provide that access to those groups. The priority groups receiving services are also known as beneficiaries, and they include vulnerable children, the elderly, persons with disabilities. And so the food is redistributed. It could be redistributed to an agency, like let's call an agency or a beneficiary organization, or an orphanage, or a school, or a daycare center. In sub-Saharan Africa, we see a lot of distribution in informal settlements and directly to households. And especially with the pandemic, distribution has been very very restricted. You can't gather 100 or 300 people in the same room. You can't have people sitting next to each other in the queue or standing for registration. So they really had to find innovative ways to redistribute the food. And in Ghana, it has been really crucial. When the pandemic hit, a significant portion of the population employed in the informal sector, in the hospitality sectors, lost their livelihoods, and increased budget deficit of up to 10% was forecast. The March Cadre Harmonisé assessment in West Africa predicted an increase in food insecurity and a slowdown in economic activities. So the food bank reacted and implemented new programming. Somebody asked about the school feeding program, and this, thank you, Katerina. This depends country to country and what the school feeding program looks like in their country. In Ghana, for example, if there are government schools that are getting a lunch or breakfast assistance, the food bank might partner with schools that are not eligible for that program, or schools that are in more rural places, and help them with some type of food assistance. Now, the NGO is still an emerging project. The food bank is still, finding a budget for themselves. So they try to help the schools, come up with a sustainable way of keeping a school feeding program, and they will connect them to that surplus food. But it's really this innovation, the Lunchbox school feeding program that launched in 2016 for Ghana, where they established kitchens in the most underserved primary schools of Accra. I guess that coupled with the 2020 innovation, the school feeding kitchen program, where the students' mothers actually develop their culinary skills and potentially gain employment. So Food for All provided food preparation and nutrition workshops for 122 mothers last year. This is theoretical and practical training, which culminated with the hiring process of the best 5 chefs, and they got hired directly by the schools. Another 2 were hired as kitchen general supervisor and purchasing supervisor for over 20 schools. So they're building up that school feeding program as a network. Another innovation that has flourished in the past year has been the mobile food bank kitchen, and now they are up to 2 of these vans. Think of a food truck. They call it the mobile food bank kitchen. It is equipped with a full kitchen, and they're able to safely transport prepared meals to communities free of costs, of course. This program has a target of reaching rural communities with high nutritional needs. And they also provide culinary training in convenient locations for the trainees. All of the prepared meals meet or exceed nutritional standards outlined by the FDA, the Ghanaian FDA. And this program has been pivotal in reaching the most vulnerable populations of wayfarers in Accra, affected severely by the lockdown, when they weren't able to set up in, one specific place. They had to be dynamic. They were on wheels with this program. So this has been a really welcome innovation to operate under pandemic-related restrictions, and it's not only in Ghana, I'm sure it's across the world. Perhaps we'll hear more about a similar innovation from my colleague, Chris. Thank you.
Thanks, Gabby. So Chris, obviously, the bulk of your work for the past 21 months has been focused on India, predominantly, not exclusively, predominantly, where the pandemic has just had absolutely devastating effects. And on top of the work of food relief going on there, our food bank partners have been very involved in a number of things, including providing medical supplies, even around support for a vaccination campaign. So would love to hear from you kind of the landscape and how it's changed, and a bit about your work there. Thank you.
Certainly. Thanks, Lisa. Actually, GFN has 3 food banking partners in India. One, the oldest is the India Food Banking Network, which has about 44 food banks across the country. And these food banks are operating on a model similar to what you are most likely familiar with regarding food banks. You know, they're collecting primarily surplus packaged goods that are donated from throughout the supply chain. The food system operates a bit differently in India than most other places, even though it's the second largest producer of food in the world. Only about 15% of the food produced is actually processed and packaged. So the vast majority of available product for food banks is grains and fresh product, and that presents a lot of logistics issues, a lot of difficulty with being able to handle it. Of course, it's the majority of it is packaged in huge sacks that are not usable for distribution to families. And so food banks, when they receive that product, they have to do some manipulation of it to get it ready for distribution. India Food Banking Network has been working over the course of the last year or so, trying to get more involved in the collection and distribution of fresh fruits and vegetables, working with smallholder farmers, and they're testing out different ways to do that. And to handle the product, which, as you would know, is volatile in terms of its perishability. So there are cold chain issues, there are logistics issues that need to be worked out. And another very common way that the food banks that are part of the India Food Banking Network engage with product donors is through donor events. It's very, very common for a donor to make a large-scale philanthropic donation of product and want to participate in a kind of a mass distribution process for getting that product distributed in a particular community or a particular area. And so a lot of what the food banks do is work with donors on setting up and managing the logistics of those kinds of mass distributions. The other two food bank partners that we have there are more similar to each other in model, although there are differences. One is Zomato Feeding India. This is our largest partner in the country. They operate in approximately 180 cities around in all 29 states. Pre-COVID, their model was based on collection and distribution of prepared foods. And that food would be coming from weddings or from hotel catering operations, corporate conventions or government conventions, those kinds of things, and from corporate commissaries, and even from some restaurants. And they would pick that food up. Sometimes the donor would chill the product and prepare it for distribution in a more slightly easier food safety management format by bringing the temperature down. But sometimes they were actually collecting the food hot and transporting it hot to the beneficiaries. They did a fabulous job of putting together very, very strict food safety management protocols, which were signed off on by the FSSAI, the Food Safety and Standards Authority of India. It's their equivalent of FDA. And one of the large food service companies provided a lot of technical assistance in helping them to devise the handling standards and the processes that their drivers would be educated on in order to test the product at the point of pickup, temperature control, and that sort of thing, and as well as at the point of distribution. And they would take the product directly from the donor to an agency, a shelter home or an orphanage or a senior services organization or even a school. And they would deliver the product into those organizations and immediately participate in the distribution and observe the consumption of the product. So they because it was so volatile from a food safety perspective, they wouldn't just take it and drop it off and trust that it was going to be used in a safe manner. Their drivers actually would participate in the distribution and make sure that it was consumed while it was still safe. They also had a major program at Feeding India that focused on schools. In India, the government operates a program called the Midday Meal Program. It's kind of similar to here in the United States, the free and reduced price lunch program that many of you may be familiar with. But not all schools benefit from that program. And so for schools that don't, Feeding India would engage with the schools to provide products so that the children in those schools would have a meal as well. Our third partner, No Food Waste, it's a little bit different. It's not a national organization, it's a regional organization. It operates only in the southernmost 4 states of the country. It currently has 14 chapters, and they have strong plans in place to add another 10 chapters over the next 3 years. And some of that is actually being funded by GFN. The way that they differ from Feeding India is that although they primarily were focused on prepared food, they didn't always do distribution. They don't always do distribution through community service organizations. Sometimes they do direct to consumer distribution. So they'll pick up product and take it to a slum or to a homeless camp, and feed people right off of their vans, right out the back of their vans, for immediate distribution. So our work with these 3 partners is focused on bringing scale to their operations and broadening the scope of their collaborative engagement. They have the India Food Banking Network is about 10 years old. Feeding India and No Food Waste are about 5 or 6 years old. And they have previously operated in silos, aware of each other, some interaction, some engagement back and forth, but nothing significant and nothing planned. And so we're working with them on trying to build a stronger collaboration, kind of an alliance of food banking systems in the country with an eye toward strengthening their collective impact, and also helping to advance the overall regulatory and legal environment. India was one of the first countries in our project with Harvard Law School's Food Law and Policy Clinic, which did an in-depth assessment of the legal and regulatory environment and devised recommendations to enhance the support and expansion of the charitable food distribution infrastructure. And those recommendations will be the focus of a public policy agenda that will be jointly developed by the 3 food banking partners with support by GFN, and then an action plan put in place to pursue the advocacy around those recommendations. Feeding India and No Food Waste literally lost their entire supply of food when COVID happened. On March 25th, 2020, the Prime Minister imposed a national lockdown, which of course meant no conventions, no weddings, restaurants are closed. And because these organizations are dependent on prepared food, they very literally lost their entire supply chain overnight. And so both had to pivot very quickly in order to be able to secure food to provide to the beneficiaries that they had been taking care of. And what they did was launched into fundraising activity to be able to purchase staple products to make up ration kits that would be sufficient to feed a family for a week. A big focus on feeding daily wagers. Daily wagers are people who travel, for the most part, travel into the cities from villages, rural villages, and they look for work every day. So at a construction site, a contractor will need 10 people, and so they'll select people from these camps of daily wagers that have gathered. And when the lockdown went into effect, millions, literally millions of daily wagers began the trek back to their villages, and a lot of the states closed the borders in trying to mitigate the spread of the virus. And so these folks were stranded and unable to take care of themselves. They had no income, they had no way to get home. Excuse me. And so No Food Waste and Feeding India and India Food Banking Network began campaigns to put together ration kits. The typical ration kits were designed to feed a family of 5 for a week. And they purchased the product and did the distribution of the ration kits to many folks, most of them the daily wagers. No Food Waste developed a plan to provide continued support to the organizations that were dependent on prepared foods because they don't have their own kitchen facilities. And so what No Food Waste did was set up community kitchens where they would get product donated or purchased, and they would make up meals that they would then distribute to those agencies that they had been providing on a regular basis previous to COVID. That idea has become very successful, and actually recent Supreme Court action in India promotes the development of support by governments, by state governments for such kitchens. And many states are beginning to set up plans. And in the case of No Food Waste, they're working with 2 of the states where they have chapters in building a plan for state support of new community kitchens developed and administered by No Food Waste. And all 3 of the partners quickly devised plans to ensure continued feeding of children who wouldn't be getting meals in schools anymore. And they did that in a variety of ways, mostly with the distribution of Nutri-Kits, as they were referring to them, for the children to use at home. When the virus peaked in India earlier this year, as you saw on the news day after day after day, the hospitals were totally overwhelmed and the country literally ran out of oxygen resources. All 3 of the food bank partners initiated campaigns to acquire and distribute oxygen concentrators, and they provided these directly to the hospitals and in some cases directly to patients who were confined in their homes. They also provided meals and health kits to the families of patients who were living on the grounds of the hospitals while their family members were receiving treatment. So people would bring their loved ones to the hospital, but have nowhere to go while they waited for their loved ones to be treated and released. And they were literally just living on the grounds of the hospital. And so all of our food bank partners developed programs where they were not only providing oxygen, but then they were providing health kits and meals for the folks who were there. When vaccines were approved for distribution, No Food Waste started a program where they would schedule the delivery of food boxes to homebound seniors, but they would coincide that delivery schedule with the scheduling of vaccine appointments for those seniors. And so the volunteer would deliver the food and then take the beneficiary to receive his or her vaccine at a vaccine center and then return them back to their home. That way, taking care of both the nutritional side and also helping to promote vaccines. You'll hear more on this from Angela and Tara, but GFN grants combined with connections to our corporate partners provided incredible support to the food bank's partners in their efforts. We were able to give technical assistance to help with program development or modification, and the connection to global corporate partners facilitated access to resources desperately needed by the food banks to serve their beneficiaries. We thank you for the support that you provided to us. Everything that you've heard Gabby and I talking about wouldn't have been possible if we hadn't had you behind us, holding us up. Back to you, Lisa.
Thanks, Chris, and thanks for that snapshot. Angela, I'd love to hear, really from you, kind of the experience that you're seeing from your vantage point, because specifically around financing, all of the shifts that had to take place in the supply chain, the challenges related to sourcing, the types of products that people were needing during this crisis meant that there was a shift to more purchasing than what food banks normally do. So if you could talk a little bit about kind of GFN's financing strategy through all of this and how it supports a lot of the technical expertise that we're engaging with as it relates to the food banks, that would be great. Thanks, Angela.
Yeah, thanks so much, Lisa. And also just thanks for this opportunity to kind of sit back and reflect. We've been so busy over the past 20 months that it really was not up until this point that I've really thought about everything that has happened with the food banks, with our organization as well. And it was great to hear the stories coming out of Gabby and Chris's regions, because I think they demonstrate as well how GFN as a team, all of our work kind of coalesces on the technical expertise, the product sourcing, as well as the financial support. So to kind of set the stage, if I may, I want to give a brief background on where we were prior to COVID. The GFN Strategic Grants Program was designed as a complement to all of the technical expertise that's being provided by our field staff, like Gabby and Chris. It provides the financial investment that supports both immediate but also long-lasting organizational growth. So prior to COVID, the vast majority of our grant funding was directed towards capacity building, with a heavy emphasis on infrastructure. So projects like purchasing and installing racking in warehouses to increase storage capacity, or perhaps establishing a produce collection point within a national wholesale market so that food banks could diversify the nutritional base of the food that they were providing to their communities, were fairly common. In calendar year 2019, we awarded 32 grants totaling $2.3 million to 22 countries. Then COVID happened and things changed overnight. We had to pivot all of our grant making support from capacity building projects to emergency relief. And Lisa, I distinctly remember receiving a call from our vice president of programs where he requested that we pull together a COVID emergency grants program within 72 hours. That was a really daunting task because the needs across our network varied so drastically. You heard some of it from Chris and Gabby, but in some cases, food banks completely lost access to their typical sources of food due to the supply chain interruptions, due to limitations on large gatherings, and also due to panic buying. So those food banks really needed funding in order to support food purchase so that they could address the needs in their communities. On the other side, we had food banks that received an influx of product donations. Gabby had mentioned the packing houses that were along borders, or agricultural companies that all of a sudden had a surplus of fruit and vegetable because the hotels and all of the restaurants had shut down. So food banks needed funding to increase their warehouse space, to rent additional storage space, and also to hire third-party logistics companies to help with the collection and distribution of all of that additional product. Chris had mentioned some limitations on mobility and restrictions on people's ability to go to their workplaces, to get home. This likewise impacted food banks and their ability to go about their work. So we had some of our partners needed funding to establish remote operations. On the other side of the coin, some of our partners were brought into the fold of national relief efforts and needed to hire additional staff so that they had enough bandwidth to cover this increased workload. So regardless of the situation, we did see three commonalities across the board. The first was the increased demand for service, which Lisa, you mentioned earlier. The second was the need to revise distribution models, which both Gabby and Chris mentioned. And the third was the need to develop and implement really rigorous safety and sanitation protocol to keep all of staff, volunteers, and the end beneficiaries safe. So ultimately, we designed our COVID relief grants program to be as nimble as the food bank's response. We mobilized funding to where it was most needed, oftentimes within hours of receipt from our donors, and with as few limitations on purpose as possible, so that the food banks could use those funds to address their emergent needs as their daily operational realities, they were changing constantly. In calendar year 2020, we awarded 193 grants totaling $15.7 million to 51 countries. And of that 15.7 million, over 14 million was through our COVID emergency grants program. There are a lot of really great stories coming out of our grants portfolio last year. A lot of what Gabby and Chris mentioned, GFN supported through our financial contributions. But there's two that I want to bring up today that really stick out for me. The first one is Food Cycle Indonesia. This organization was established in 2017 to serve the people of metropolitan Jakarta. And in 2019, GFN had an opportunity to provide some seed funding for the food bank to establish an additional warehouse and distribution point in Banten province, just outside of Jakarta. Right before COVID, that additional warehouse space became operational. So it was a combination of being able to provide the seed funding as well as GFN's technical support and guiding the food bank, developing their emergency response plan, as well as the additional COVID funding that placed the organization in a really secure spot to be able to address the needs within their service area. And because of all of this, the food bank actually increased the number of people that they served from 2019 to 2020 by over 800%. It's huge growth considering how young and small the organization was. Tara, did you want to jump in?
Yeah, thanks. Yeah, that's really tremendous growth. I just wanted to add a point on this because in tandem with this infrastructure expansion, the food bank also quickly accelerated its product sourcing efforts with support and guidance from GFN. And as a bit of background, Food Cycle started as a food rescue organization with surplus from wedding dinners being its primary food source. With GFN support, those sources were expanded prior to COVID. But like in so many other countries, hotel meal rescue as a product source all but stopped, right, once COVID lockdowns came around. So in the midst of multiple crises, this food bank developed new corporate product sourcing relationships that they continue to nurture and build upon today. So thanks, Angela.
Yeah, no, thanks for that addition. Another organization that stands out for me is our partner, SESC Mesa Brazil. This is a national network of food banks. There are 91 food banks operating throughout the country. And prior to COVID, they operated more or less independently of one another. And it was COVID, as well as the technical expertise provided by our LATAM team and the funding that we were able to provide the food bank that really served as a catalyst for that organization to come together and develop a national bulk food purchase program. So the concept of this program is, rather than having 91 food banks running around developing relationships with food producers and different companies in order to secure their key food staples, which they weren't able to get through the usual donation chains. By having the national network do that, they were able to get a reduced price on quality product, but also ensure that they had a steady stream of key products like beans, rice, and cooking oil throughout the whole entire network. And through this process of developing a collaborative, consolidated national level program, they also strengthened the relationship between all of the organizations in their network. And this ultimately resulted in an increase of over 50% in the number of people served from 2019 to 2020. So I think this is a really great example, both locally, with the food banking organization itself, but also the relationship between GFN and that food bank that, when we're operating alone, we're limited in what we're able to accomplish, but then when we come together, we can achieve so much more.
And just on that as well, Angela, GFN put together purchasing training and a toolkit to help MESA and other food banks as well navigate through this really challenging space, which for some food banks was actually almost entirely new. And in many cases, those purchasing relationships ultimately expanded further to include product donation relationships thereafter. And I think it's a fabulous example of how food banks are building on the relationships that were born at the height of the pandemic with all manner of product partners.
Yeah, so Angela, that was really fantastic. Thank you so much. Now, Tara, I'm very excited to hear from you. So we know that in normal times, food banks are accessing this wholesome, edible, nutritious food from surplus supply streams, right? And we know that nearly a third of all food produced is somehow lost or wasted along the supply chain. So there's definitely opportunity, especially as we move towards 2030 and the Sustainable Development Goals of trying to have food loss and waste. There's definitely an opportunity to recover so much of what is nutritious, for redistribution to people who need it. Now, during the pandemic, at the early stages in particular, so many food banks experienced what retailers and manufacturers experienced, which was incredible disruptions. So the surplus was there, but it just couldn't be captured in the same way it had during the prior to the pandemic. So would love to hear from you kind of some of the strategies around how food banks adapted to that. How significantly did purchasing go up? Do you feel like that's here to stay? And maybe even some snapshot, look at kind of what was recovered, what was purchased from the network over in 2020. So thanks, Tara, over to you.
Yeah, thanks, Lisa. Well, I've already jumped in a couple of times with some examples there, but I have a few more that I'd like to share. I mean, just on purchasing, I think we can hop back to Chris's earlier points on India, where there's a great example there around purchasing relationships. So in buying product, in some cases for the first time, or at least in larger volumes than food banks have ever had to do before, the food banks needed to stretch their budget even further than usual and far more than they had expected when they started out the year. And GFN's global corporate partners, such as that large food services company that Chris mentioned earlier, enabled food banks to use preferential rates for purchasing from the company's suppliers, which led to even greater value for money. So they were able to access that product and really stretch that dollar even further. And also, around the ration kits and meals, GFN supported food banks in sourcing and packing and distributing the hygiene kits, which Chris had mentioned earlier. A couple of other quick examples I want to highlight. There are so many, Lisa, really, there are so many innovative examples, across the network. But a few that I want to highlight because of just how varied they are, to give you a sampling of some of the product sourcing strategies and engagements that we supported, and enabled food to reach people directly against the odds in many contexts while reducing waste. And the first is, due to the travel restrictions brought about by COVID, they abruptly caused food on cruise ships to be stuck on tarmacs, unable to be used, though safe for consumption. And GFN's product sourcing team took the opportunity to make a connection between cruise line companies and the food banks in the countries where these ships were located, so the food was not wasted. And another instance, there was a large volume of toddler biscuits that were designated for online sale for global markets, and they were meant to be shipped from China. Now, various impediments to trade and movement at the time caused them to be stuck at port, but not packaged in a way that could be distributed within China. So GFN supported the movement of these biscuits to the Philippines for free distribution by our food bank partner there, Rise Against Hunger. And one more example, if I can squeeze this in, Lisa, is from Ethiopia, where the food bank held a farmer conference. And through that, they engaged directly with farmers that had found themselves with excess product on field due to COVID-related supply chain disruptions. So together, the food bank and the farmers worked directly with each other to develop a solution that leverages the surplus on farm and reaches more people with fresh produce. So a couple of quick examples to highlight the scope and breadth of the type of innovation that's taken place in terms of product sourcing.
Great. Thanks, Tara. There's a couple of questions that have come in, and I would encourage everyone in the time that we have left, please submit any questions or thoughts you have in the Q&A box. But Tara, I'm actually going to send this first question to you because it talks a little bit about what you were just referencing. And it says, was it GFN that helped build the bulk food purchase model? And does that kind of collaboration exist between food banks and other countries as well? And essentially, are we doing bulk purchasing, for multiple food banks across country lines?
Well, I've got to first admit that I was not at GFN when this was happening. I'll be honest here with you. So let me just reread that question. So there are a couple of parts to it, I think, right? So was it GFN that helped build the bulk purchase? I understand that GFN supported, so the example that Angela brought up earlier around MESA, GFN certainly supported the building of that and provided resources and guidance around how that's done. Does that kind of collaboration exist between food banks in other countries? So I guess where there are food banking networks in countries where where our partners are a network of food banks, yes, I believe that does exist. But where there are individual food banks across individual countries, then I don't believe that that's the case. But I don't know if any of my colleagues want to step in and add anything to that.
What was so interesting to Katerina from Tetra Label, who asked this question, what was so interesting is that even though there was a significant amount of purchasing that did occur in 2020, and a lot of it had to do because the food access, the types of food that clients were able to access also changed, right? So they needed far more staples, basic pantry staples, than what was needed prior to the pandemic, just because so many people lost essentially their full ability to access food through the commercial chain. So that was part of the reason that drove the shift. But in spite of all of that, in 2020, only 15% of the total food distributed through GFN network food banks was purchased, meaning 85% of it was recovered. And what we found is that the nutritional density and the nutritional value of the food that was distributed or recovered went up. And that's because what Tara and Angela and Gabby and Chris have referenced was that the organizations were able to shift their recovery efforts to different parts of the supply chain. So the manufacturing recovery remained very stable. Retail declined because there was incredible pressure on the retail portions of the supply chain. All of us who live in high-income countries know we were all rushing to grocery stores and Costco's and buying as much as possible early on, and that really had an incredible negative effect on the supply chain piece. But we saw that the agricultural sector of the supply chain recovery in that area went up significantly. So I think this has been a huge learning experience for food banks, that their ability to recover from different players, different producers has really increased. And I think that's something that's going to stay with us as we move forward kind of into this post-COVID era. I wanted to ask Chris that, and Gabby, whether or not you've noticed that some of the regions served by GFN are challenged more than others since COVID hit. And when asking this, I want to do it from the perspective that, GFN for a long time had its footprint in Central and South America and in East Asia. And then over the past 3 years, most of our service has been expanding due to demand in Southeast Asia, South Asia, and Sub-Saharan Africa. So, Chris, having been with GFN for now 15 years, as you kind of look at the global landscape, have you seen this pandemic affect certain regions more than others?
Yeah, certainly. Certainly, the wealthier countries, just by definition, had greater resources, and so the influx of those resources, while their need went up significantly, and their activity level went up significantly, the resources to underwrite all of that came much more easily. So you look at India, for example. When it got really, really bad in the spring of this year, even though the food banks were able to put together successful fundraising campaigns, the scale of the impact of COVID on the country as a whole and on the pre-COVID level of need could not be matched by the success of their fundraising campaigns. And so while all of them had experienced an increase in service and a broadening of service and were able to quickly pivot and change their models, all of that combined relative to the COVID impact on escalating the need fell short. You know what I mean? And so they were much more challenged at being able to respond than say the United Kingdom or Canada.
And I think too, what you saw echoed there as well is that the social protection response in many, nearly all of those countries was incredibly limited.
Right.
And a lot of the clients, Chris, I know, and Gabby, that you talked about, migrant workers, daily wagers, especially some of the children that were receiving meals at school, but through schools that were not necessarily formally recognized by the government. I mean, those clients had access to no social protection whatsoever. So they really only had the nonprofit or the third sector to be turning to for any types of support. And I think that's a big takeaway, at least for GFN, is, in a place where government aid is so insufficient, as we kind of work for longer term protections for clients, how can we be better supporting, especially very vulnerable populations in the interim? So we had another very interesting question come through, and from an anonymous attendee, and they mentioned that in many cases, the pandemic highlighted that the operating model of food banks, it can be viewed as not very sustainable because of the supply chain interruptions. So what are some examples of work done to innovate or disrupt the model itself to make it more sustainable and potentially less dependent on charitable food donations? And we talked a little bit about this, and Tara, can I turn to you first and then maybe Angela to speak to that?
Sure. I think, one of the key things is really diversifying sourcing, right? So when it comes to product sourcing for food banks, a reliance on something that many food banks found as well, a reliance on perhaps just one point on the supply chain can be pretty dangerous when there's a disruption. So it was a challenging learning process for many food banks and for all of us. But I think that diversifying sources across different points on the supply chain is really essential in building resilience for food banks.
Great. Angela, would you want to add anything to that?
Yeah, I think more on the side of how the food. Tara spoke about how we secure the food, but I'd like to talk a little bit more about how we end up distributing the food. A lot of food banks, and I think Gabby mentioned this, they work with community organizations that are providing other types of social services. So the food bank provides the food, and then that organization is providing some other sort of wraparound service, whether it is job training or counseling or something along those lines. So I think during COVID, what we found is that many of those community partners, their operations were interrupted. So they weren't necessarily able to accept the food that the food bank would normally distribute through them. And the food bank wanted to make sure that the community, whether or not those partners were operating, that they were able to still receive food bank food. So where we saw a lot of the innovation and change in model of distribution is the food banks finding ways, not working through the community organizations as they typically would, but delivering the food directly to the end beneficiaries. So that could be through these community kitchens that Gabby had mentioned, through the food parcels that Chris had mentioned that were delivered to families either in partnership with the vaccination campaign or directly to hospitals where you were finding people just staying there while they were waiting for their loved ones to be released from the hospital. Also, we saw, these were quite interesting, we saw a lot of kind of drive-through food distributions, which we saw here in the United States as well. And one of those actually in Australia, there were so many cars, or was it New Zealand or Australia? I can't remember. Maybe my colleagues remember. But one of them had so many cars, I think it was over 1,000 cars, that the police actually had to come and shut down the operation because it was becoming a security issue. So the food banks, when we talk about innovation and disruption in the model itself, I think it's more along those lines of where are we actually sourcing the food along the supply chain, and also how are we distributing it to the end beneficiary.
Absolutely. And the other thing I think we think about a lot, and this is part of I think the transition we're all making that are working at any point in the food supply chain, right, is that on one hand, we absolutely are, a stopgap measure for, people that might not be able to access food for a short period of time, trying to support agencies that address these root causes of hunger and poverty. On the other hand, food redistribution in a lot of ways from a food systems perspective is capturing this surplus product that would otherwise be landfilled or go to waste, right? And so we know there's an enormous amount of that surplus product available. Now, of course, our first priority needs to be how do we prevent surplus from occurring? And that's why GFN is involved in so many efforts, with both governments and companies to think about how do we even get to that point where you can be better predicting how much supply you're going to need to meet demand, so you don't put in the labor, the environmental investment that's needed to produce this food. How do we reduce surplus at the top level? But even there, just because of the enormous amount of food that is currently going to waste, there is this moment of opportunity, at least currently, for redistribution. So I think for a lot of us, it's about shifting the mentality. This is not just charitable food that companies or food producers are giving. It's really almost a solution to how we make the food system more sustainable and resilient long term, even if that means that we eventually reach a day, who knows, in the future, where there's less surplus available for recovery. And I think that's where you're really going to see kind of some additional innovation in the model. So I want to go back to one of the questions asked earlier, and Gabby spoke to it a bit, but was around school feeding. So we know that at the height of this crisis, when we saw closures across 90 plus countries, there were something like 360 million children that were relying daily on meals at school that were not able to access those meals any longer. And so we have a number of food banks, over 24, that are actively providing meals at school, either breakfast or lunch or after school meals. And so, Gabby, you spoke a little bit about that provision during this. So I was wondering if you could say a little bit more about that context, specifically in Sub-Saharan Africa. And then, Chris, I wanted you to talk a little bit about the Indian approach as well. So, Gabby, over to you.
Thanks, Lisa. And this has been programming that the food bank like in Ghana had since 2016 before the pandemic. When we've been in country, we've actually met with, for example, the National School Feeding Program and the secretary of the program. And it really depends on the infrastructure of the country, the resources they're allocating, and which schools are participating, what the requirements are. The food banks tend, well, in sub-Saharan Africa, the 6 that we're working with tend to supplement the efforts of the school feeding program and direct their donation of product to schools that don't have any school canteen, no school breakfast or lunch program. And they set up, different metrics. They evaluate the physical well-being of the child, but also their performance in school now that they're getting at least that meal a day. They've actually seen an increase in attendance, increase in enrollment. In many of the cases in sub-Saharan Africa, it's not just the kids that are enrolled in school, but their little brothers and sisters or the neighbors or children from the neighborhood that really don't have access, seeking these resources, and the schools come up with different ways to address this, right? It might be a small parcel they get to take home. It might be a supplement to the family as a package of staple food for the month. But everything is really, it's coordinated in a holistic way so that they can help uplift that family, not only the child in that program.
Chris, what about in India? Specifically just with the increase in especially children living on the streets as a result of this.
And so prior to COVID, two of the 3 partners had some kind of school-related feeding program with the India Food Banking Network food banks. They were largely doing supplement to existing school feeding programs where they were trying to add some protein by providing eggs or adding fruit to existing meals, those sorts of things. So they had some connection with the schools. And Feeding India, Zomato Feeding India had a much bigger, much more developed school-based feeding program, as I mentioned earlier. So they took advantage of those relationships that they had with the schools that they were providing those services through, and they developed these Kits that I mentioned, packages of food, ration kits of food for the children, and in some cases for whole families, not just the children. And then they would use the schools where the schools were closed, but they would use the schools as distribution points, and so they would stock the Kits into the schools, and the school systems would provide notification to the families that the product was available and that they could come to the schools to get the kits. And in some cases where they weren't able to use the schools, they just worked through other NGOs in the neighborhood and would do the distribution of the Kits through those sites.
Well, I think, though, that in spite of some of the challenges of the past 21 months, and just for those of you here today, the situation has obviously improved, which has been a relief to many. We are still seeing an incredibly heightened demand, though, for service. Especially in the emerging market and the developing market setting. So I just want to step off and just say thank you again to all of you, not just for your support at the start of the pandemic, but also for your ongoing support as we really look to address some of these bigger challenges I don't even want to call it the post-pandemic world, but in this new reality where we are living with this heightened demand for food relief, and likely will for quite some time. time. We had one final question, and this is actually from Alan Gilbertson, who used to be our board chair, and he's always such a visionary. And he says, food banking massively reduces food dumping into landfills. Does this and the increasing focus on climate change open up new opportunities for the model? And so I just wanted to just give 30 seconds. And Tara, I'm going to ask you to respond, if that's okay. Then I can also add some thoughts before we wrap up. But I thought that this was a great question to end on, considering we've just come out of COP26. We're seeing so many heightened natural disasters in many of the markets that we work in, alongside the challenges brought by COVID. So Tara, if you had to give a 30-second response to that, what would it be?
Certainly, there is a whole lot more attention from our product partners on reducing food loss and waste in their supply chains. We certainly want to, as Lisa mentioned earlier, we are certainly working towards reducing waste across the board. But where the opportunities exist around surplus, I think food banks are increasingly being seen as a really critical business partner to many companies in managing surplus that could not be otherwise managed. So yes, in a word, and I think the recent reports from FAO and the UN Environment Programme earlier this year around food loss and food waste have further heightened not just the need, but the attention as well on reducing food loss and waste. Does that make my
Thanks.
30 seconds, Lisa? Yeah.
That was great, Tara. Thank you. And thanks to all of you today. We are at time, and we want to be very respectful of that. I wanted to say a couple of things in closing. The first thing is that we at GFN currently have a match campaign underway, provided by a very generous anonymous donor. So all of the donors that gave during the COVID pandemic for the first time, if you were to make an additional gift before December 31st, it will be matched at 100%. If you have any questions about that, you can reach out to your contact at GFN or to Caroline Parsons here. The second thing is that our annual report will be released next week, and it's going to feature many of the vignettes that have been talked about today, and talk specifically about GFN strategies over the past year and how that compares to the overall development of our organization over the past 15 years. So we'll look forward to sharing that with you and hearing your thoughts on that. For our partners this spring, we are also planning to host a virtual tour of a food bank in our network. So please keep your eyes open for that, for plans on that after the new year, because we want to give you a sense to really see kind of what our partners are facing and working with. And of course, if you have any comments, questions, want to discuss further with any of our panelists or myself, we would love to hear from you. So please don't hesitate to reach out. So thank you again so much for your partnership, for your time, for your interest. We truly would not be able to do the work we do without your support. And we wish you a great day, afternoon, or evening. Thanks again.